Hello everyone, I welcome you all to today's topic Decodified session. Today we are going to talk about the drug menace. We shall be covering this particular topic in the following sequence: why it is in news, what is drug abuse, India and drug abuse, government initiatives against drug abuse, followed by the practice questions. But before that, I want you all to be informed about the Mains 8 2022 program by Analyst IAS, wherein you can get help for polity, essay, public administration, ethics. Do check out the details given over here and apply soon to improve your scores in the mains examination and of course to avail the early bird discount. Now getting back to the topic, why it is in news. So Home Minister Amit Shah says states must work in tandem with center to fight drug menace. Amit Shah was actually addressing a conference of Narcotics Bureau of India in Chandigarh. And there he has made this statement which gives us an opportunity to actually discuss about the drug menace in India. So what is drug abuse? World Health Organization defines drug abuse as the harmful or hazardous use of psychoactive substances including alcohol and illicit drugs. Addiction is an advanced stage of substance abuse where the addict develops a compulsion to take the drug, persists in its use despite harmful consequences, and exhibits a determination to obtain the drug by almost any means. Psychoactive substance use can lead to dependence syndrome, a cluster of behavioral, cognitive, and physiological phenomena which are marked by social withdrawal. Symptoms of addiction include loss of appetite and weight, loss of interest in day-to-day work, sweating, reddening of eyes, nausea or vomiting and body pain, drowsiness or sleeplessness and passivity, acute anxiety, depression, mood swings, among others. Now, what all are the categories of drugs? Number one is opiates like heroin. Then there are stimulants like cocaine. There are depressants like alcohol, minor tranquilizers like Valium, hallucinogens, magic mushroom. Then there is cannabis. There are solvents like aerosol cans, herbal highs which are now illegal, tobacco, example, cigarettes. So India and drug abuse. According to a report by United Nations Office on Drugs and Crime, UNODC, India is one of the major hubs of illicit drug trade, ranging from age-old cannabis to newer prescription drugs like tramadol and designer drugs like methamphetamine. The money from the drug trade is used to finance terrorism, human trafficking, illegal businesses, etc. India lies in the middle of two major illicit opium production regions in the world, the Golden Crescent in the west and the Golden Triangle in the east, which makes it viable hub of the illicit drug trade. I am going to show you both the locations on map, but before that let me tell you a bit about them. So Golden Triangle, it includes the regions of Myanmar, Laos and Thailand and is the Southeast Asia's main opium producing region and one of the oldest narcotics supply routes to Europe and North America. Golden Crescent includes Afghanistan, Iran and Pakistan and is a principal global site for opium production and distribution. Now look at this map. This is Golden Crescent and here is Golden Triangle. Then have a look at India's position, which makes it very vulnerable for the drug abuse, drug trafficking and ultimately the drug menace which has been eating up into the Indian youth. Major reasons behind drug abuse: abuse of drugs among friends and peers, lack of social support, stress in life, low socioeconomic status, mental disorders such as depression, lack of friends in school or any social setting, traumatic events. The economic downturn caused by the global pandemic may drive more people to substance abuse or leave them vulnerable to involvement in drug trafficking and related crimes, because pandemic has aloofed people from their social connections. It has made them economically weak and lacking in social support. Of course, this isolation has also made them vulnerable to many kinds of mental disorders as well. So all of that, which can be a reason of drug abuse, has been exaggerated, aggravated by the pandemic. What are the consequences of drug use? One can be in a trouble because of poor health, as it increases the morbidity and mortality. So morbidity as in you are more prone to get sick, and you can even die because of the imbalance in the dosage. Then the family suffers. There are fights, there's neglection. It leads to separation or divorce and loss of trust. Social consequences are the stigmas attached to drug abuse and also isolation. People will always avoid those whom they would know are addicted to drug, and these people may not be accepted into the society even once they are rehabilitated. So it can lead to prolonged isolation, and hence social rehabilitation can be really difficult for people who use drug. There can be occupational consequences. Your profession may suffer. There can be absenteeism, reduced trust of co-workers or the employers, and ultimately loss of job. The financial consequences are over expenditure on drugs and debt. Legal consequences can be, since one is not in control of one's own hormones, one's own thought process, it can lead to fights, accidents, and other all sorts of crimes one can do to actually obtain drugs or because of having consumed drugs. Government initiative against drug abuse. Article 47 of Directive Principles of State Policy of the Constitution of India directs states to improve public health and endeavor to bring about prohibition of the consumption of intoxicating drinks and drugs which are injurious to health. India is also a party to the 3 United Nations Drug Conventions: Single Convention on Narcotic Drugs 1961, Convention on Psychotropic Substances 1971, Convention Against Illicit Traffic in Narcotic Drugs and Psychotropic Substances 1988. To tackle the problem of illegal drugs, Parliament passed Narcotic Drugs and Psychotropic Substances Act of 1985 as a comprehensive legislation on narcotics, providing for stringent and long-term prison sentences and heavy fines for offenders. Similarly, the Parliament also passed the Prevention of Illicit Traffic in Narcotic Drugs and Psychotropic Substances Act 1988. Government has adopted a multi-pronged strategy to deal with drugs control by establishing enforcement agencies like Narcotic Control Bureau, NCB, Narcotics Control Division, Department of Central Excise and Customs, Revenue Intelligence, and Paramilitary and Armed Forces. It has also constituted a joint committee to curb the menace of drug smuggling into India along international borders, which comprises 4 central ministries: Home Affairs, Health, Finance, and Social Justice and Empowerment. So the various steps taken are as follows. Coordination with various international organizations. The Narcotics Control Bureau, NCB, coordinated with various international organizations for sharing information and intelligence to combat transnational drug trafficking. They included SARC, BRICS, Colombo Plan, ASEAN, BIMSTEC, United Nations Office on Drugs and Crime, and International Narcotics Control Board. Coordination among various central and state agencies. For this, the Narco Coordination Center and CORD mechanism was set up by the Ministry of Home Affairs in 2016 for effective drug law enforcement. This NCORD system was restructured into a 4-tier scheme up to the district level in July 2019 for better coordination. A joint coordination committee with the NCB Director General as its chairman was set up in July 2019 to monitor the investigation into cases involving large seizures. SIMS, that is Seizure Information Management System portal for digitization of pan-India drug seizure data. The Ministry of Home Affairs launched an e-portal called SIMS in 2019 for all the drug law enforcement agencies under the mandate of Narcotics, Drugs and Psychotropic Substances Act (NDPS). National Fund for Control of Drug Abuse. It was constituted to meet the expenditure incurred in connection with the combating of illicit traffic in narcotic drugs, rehabilitating addicts, and educating the public against drug abuse, etc. National Drug Abuse Survey. The government is also conducting the survey to measure trends of drug abuse in India through the Ministry of Social Justice and Empowerment with the help of National Drug Dependence Treatment Center of AIMS. Project Sunrise. It was launched by Ministry of Health and Family Welfare in 2016 to tackle the rising HIV prevalence in northeastern states in India, especially among the people who were injecting drugs because they use syringes and hence can lead to deadly diseases like HIV/AIDS. Role of Ministry of Social Justice and Empowerment. This is the nodal ministry for drug demand reduction that coordinates and monitors all aspects of drug abuse prevention, which include assessment of the extent of problem, preventive action, treatment and rehabilitation of the addicts. It has the responsibility of creating awareness, educating people about the ill effects of drug abuse, its identification and rehabilitation. It supports activities of non-governmental organizations working in the areas of prevention of addiction and rehabilitation of addicts, and also funds Panchayati Raj institutions, urban local bodies, etc. to deal with the same. The ministry has been implementing the scheme of prevention of alcoholism and substance, that is drug abuse, since 1985, which stresses on developing culture-specific models for prevention of addiction and treatment and rehabilitation of addicts. Presently, about 350 to 400 integrated rehabilitation centers for addicts (IRCAs) are functioning with the support of the ministry. National Center for Drug Abuse Prevention has been set up for capacity building and training of NGOs running de-addiction centers. Now let's talk about the World Drug Report 2021. Around 275 million people used drugs globally in the last year. Over 36 million people suffered from drug use disorders. Rise in the use of cannabis during the pandemic has been reported by most countries. Non-medical use of pharmaceutical drugs has also been observed in the same period. The latest global estimates say about 5.5% of the population between 15 and 64 years have used drugs at least once in past year. Over 11 million people globally are estimated to inject drugs. Half of them have hepatitis C. Opioids continue to account for the largest burden of disease linked to drug abuse. And we know that India lies right in between the Golden Crescent and Golden Triangle, which produces opium. That is, India lies between the greatest sources of opium to the world, or greatest source of opioids in the world, which makes India very prone and vulnerable to the drug menace, and that's why the strengthening of countermeasures for prevention, for investigation and for curing and rehabilitating people is of utmost importance. So according to an estimate in comparison with 2018, by 2030 in high income countries the people who use drugs is going to decrease by 1%, while in middle income countries it is going to increase by 10%, and in low income countries it is going to increase by 43% by 2030. So this is the scenario as far as drug use in India and world. Now let's look at the prelims practice question. Consider the following statements about UNODC. It was established in 1997 and was named UNODC in 2002. It acts as the Office for Drug Control and Crime Prevention by combining the UNDCP and the Crime Prevention and Criminal Justice Division of UN Office at Vienna. Which of the following statements are correct? You need to pick your answer from the following combination: A, 1 only, B, 2 only, C, both 1 and 2, and D, neither 1 nor 2. Pick the correct option and put it in the comment box as your answer. Your mains practice question for today is: increasing drug menace across northern states in India needs strict laws and coordination among various states' government. You need to answer this particular question in 150 words and send in your answers to us on WhatsApp to get them reviewed. This is it for today. I shall see you again tomorrow. Till then, take care, stay tuned.